Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, the Pain Case Study, Example, Part 2. Primary exercises applied. Cognitive, Behavioral, Behavioral 2, Anesthesia, Behavioral 3, Anxiety. Self-esteem, Combined Crisis Salivation Room, Post-Hypnotic Order, Whispering Technique. Secondary exercises applied. All positive, a drop of happiness, the 7 energy points, Coe method. These secondary exercises have not been applied all together. Following the primary exercises in order of application. Completion, key, exit. All this was combined with hypothermia exercises in the abdominal area. As mentioned above, this patient feels a want of pain. According to our expectations and seeing the progress of the therapy, surely in 3 or 4 more hypnosis sessions, the pain will have subsided to a minimum. Afterwards, a follow-up and possibly some reinforcement sessions will be done. Unification and non-duality mind-body. Since ancient times, the study of man has always been done from 2 different dimensions. Man's body and mind have been studied as 2 differentiated, non-integrated entities that coexisted, intimately related but independently. This bipolarity established by the classics has been increasingly criticized, and nowadays it can be said that the holistic treatment of the human being by any specialist is becoming more and more unanimous. We can find this mutual influence in the effects that many drugs have on our nervous system and ultimately on our mind. Many drugs used for therapeutic purposes can decisively influence our mental processes. Benzodiazepines are often used to combat some negative emotions temporarily, and it is well known how excessive caffeine consumption increases anxiety. Conversely, emotions can trigger specific bodily reaction. When we feel fear, the nervous system is activated, causing an increase in adrenaline, and our heart rate and breathing speed up. This allows us to be alert to act in case of danger. We are ready for action, to attack or to flee. Conversely, if we are calm and relaxed, our nervous system also relaxes, our heart rate slows, and our breathing slows down. Based on this interaction between our body and our mind, hypnotherapy proposes the healing of physiological ailments through hypnotic suggestions of the mind. Any kind of suggestion can be beneficial or detrimental to our body. It is not necessary to be in a hypnotic state to accept suggestions that can change our perception of reality. This is true, but it is also true that under hypnosis, the person is much more receptive than in a state of wakefulness. This makes it the optimal state to receive these kinds of suggestions. It has been demonstrated through numerous experiences and studies that positive suggestion by means of hypnosis can distort the sensation of pain of a patient. One can even speak of hypnotic anesthesia. That is why it is important that these suggestions are positive, because if we allow our negative thoughts, our feelings and their action on our organism will also be negative. Hypnotherapy will also help us to change our way of thinking if we have a bad habit of thinking negatively, by helping us to change our habits. Let us think that it is possible to re-educate our mind so that a new and positive point of view on things predominates over the unconscious. In short, it is about using the mind for the benefit of the rest of our own organism. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Aversive Exercises for Tobacco Addiction, Part 1. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and you can also download several free ebooks. If you have questions, add them in the comment area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.